Good morning. Welcome into today's Chiropractic and Nutrition here on Unforgettable 1220 and Classic Hits 99.7. Chris Roberts here, and with us in the studio, Deb Ford, MSRD of the Good Earth Health Food Shop on South Shannon Street in Van Wert, and Dr. Ian Rainey, Doctor of Chiropractic. And today, a show for professionals. Probiotics?
Yeah, probiotics.
That has nothing to do with being professional, though, does it?
No, not professional. Matter of fact, it is one of the most basic things for health. With winter right around the corner and respiratory infections starting to rear their ugly head already.
Oh, no.
Yeah, people in the hospital, I guess pneumonia is more abundant than it should be at this time of year. We need to start taking proactive and preventative approaches to boost our immune system to help prevent all the bugs and bacteria that tend to thrive when we close the doors and we're inside with those germs all the time.
So it probably wouldn't be a good idea for me to say, oh, I want to feel better, so I'm going to take an antibiotic or something like that.
Antibiotics, that's the thing, the pro versus the anti.
That's a very good.
And there are times when you need medicine, and there are times when you actually have to be careful with the use of probiotics. But abundantly, we need more probiotics. We need those good, healthy bugs that are really designed to populate not only our digestive tract, but they're found everywhere on our skin, in our nose. And what's really amazing is it's just not for digestion. They're finding strong correlations to things totally unrelated to digestion.
What are some of these things? Let's tell the listeners, what are some of the things that they can benefit from besides just,
boosting mood, helping the nervous system, bone density.
Wow, that's so really. So if you're thinking about taking probiotics and you hear all these wonderful things that are capable of being improved in your life, we're going to explain a little bit about why that happens and a little bit more detail.
And in the beginning, it really, when we come into this world, we are neutral. We really don't have much of an immune system of our own. We only
Other
have
than
that
what you inherit
from your mother, temporary from the mother. So the increase in asthma and allergies, they are linking to the way we have been addressing the whole birth with the sterilization and taking babies away from mama immediately. Babies that are C-section because they don't get the initial bacteria from the birth canal. Have those babies have a much greater risk of asthma and allergy-related problems.
So when you're born and you come out the birth canal, you get a lot of that bacteria that you need. It's almost like the starting base, the starting point that you need to develop.
Yeah, the body has to have a little bit to fight and build the immune system while you still have mama's immunity. The baby needs to start developing its own. The old saying, you need a pound of dirt, you really do.
You can just watch any alien movie of the last 20 years where aliens have invaded the Earth.
Sci-fi channel,
and find out that they all die off because they can't deal with our
immunity. And really, Native Americans, when we came over from Western Europe, we introduced a whole different strain that they were not immune to. They died, unfortunately, a lot of them. But so it is important to always give your immune system a little something to have to work. So they say, even your fruits and vegetables, wash them, but don't get rid of everything because you need some of that. Then the soil really needs to have, we don't want to have sterile soil. You need some of those good bugs in the dirt to help things break down.
Well, if I wanted to get really nerdy, I would say that really your body is a collection of bacteria. I mean, really, that's kind of what we are.
And in fact, there is more bacteria on you than you have that is you.
Wow. Now, is it also true that there are more bacteria than there are cells in your body? So you need as many bacteria. And
you need to have a good relationship with these little bugs.
It's a balance, isn't it?
It is a balance.
Like everything else in life.
Right. And when people take antibiotics, which sometimes are necessary. You know, it's to kill off the bad bacteria. So it's important
for emergency situations.
For emergencies, and it's very important to reestablish the good guys, or you're going to be fighting it.
What I'm hearing is the
biotic.
Antibiotic would be a targeted type of a drug.
It's not really. It's just it kind of is, but it's going to kill off a lot.
But why would an antibiotic, for example, have to be prescribed and a probiotic not prescribed?
Well, probiotics come from food.
They're natural.
They're natural. They come from food. I mean, every time, you eat sauerkraut, every time you eat yogurt and kefir and buttermilk, we are designed to always keep reseeding the good bacteria because they don't stay there forever. Now, antibiotics, when the bad guys get out of control, then you need to take the antibiotics to kill them off so that the body can kind of build its response.
And the antibiotics don't exist in nature. They're man-made.
Right.
Yeah.
Well, they have to tweak them from the mold on bread. And in this day and age, there are more and more antibiotic-resistant bugs out there. So it really behooves us to really have a good, strong immune system. So, one of the best things to do is first start out with some of the probiotics that will adhere to the gut lining, because not all of them do. A lot of times, if you're taking probiotics, they only will grow as long as you keep taking them. But if you provide a good foundation with, and they're huge words, I wish they weren't, but they are. So Lactobacillus acidophilus is one that if you haven't ever taken probiotics, or you're just coming off of antibiotics or taking them at a different time of the day, you need the acidophilus.
So it's like a good foundation.
It's a good foundation. That's a real good way to put it.
Okay.
Then, after people take that, then we want to start spreading the foundation.
Okay.
Because a good, healthy probiotic base in the gut isn't just acidophilus. You're going to have Helveticus, and you're going to have longum, and you're going to have reuteri and niger. And one of my favorites is Saccharomyces boulardii.
And what makes that your favorite?
Well,
Fun to say. That's what makes
It's a beautiful
it is
name.
Fun. It is fun, but
has an Italian background.
That's me. But Saccharomyces boulardii. When I was doing my internship at St. Rita's, there was a lot of C. diff at that time, which is a very dangerous imbalance in the system, so that they were having to hit the patients with a lot of different things. But there were some very fundamental studies done using Saccharomyces boulardii to control C. diff.
Wow.
So, I mean, it has to be done carefully and with doctors overseeing the situation, but it really helps keep some of those bad guys in check.
So it's one of your favorites, not just because it sounds Italian, but because it's saved many people's lives.
Yeah. And, they've also been using Saccharomyces boulardii with really an unhealthy or inflamed gut, like with ulcerative colitis, with Crohn's disease, irritable bowel syndrome. Also for things as totally unrelated, as far as we know, acne, canker sores, high cholesterol, urinary tract infections. You just can't. These little guys, we really need to have a good relationship with them because they are so good for us.
Well, we hear all these wonderful things. And I mean, you can go to PubMed, that's the medical review literature, and you can go and look at journal after journal after journal of trial that's been performed and it shows the evidence for all of these statements.
Well, and the one Lactobacillus reuteri, that several years ago kind of came out strong because it was really good for quickly taking care of diarrhea.
Okay.
But some of the more profound studies are finding bone density. Now, how on earth that can affect bone density, I'm not sure. But it's that optimal gut health and immune health It's just pretty far. We're not isolated. I guess, we're not the kidneys, that system, and we're not the digestive system. We are a whole, and that really is the whole basis of holistic medicine, looking at the body as a whole. You can't have upset digestion and good health. It just all goes together.
Yep. The good word is symbiosis, a good symbiotic relationship with all this bacteria. And you're looking at some of the bacteria, like you said, the Lactobacillus gasseri. That one, that's got a strong correlation with IgA. It sounds like gasseri, but it's actually beneficial.
Yeah, it is good. And that Dr. Oz is all over gasseri. Yeah. And we carry it at the shop under Acidophilus.
Okay.
The gasseri actually is good for gas, but it also is really good for weight loss.
Yeah. Wow.
Yeah.
Huh.
Yeah. So it's in the British Journal of Nutrition in 2013 and European Journal. They found significant correlations between people taking that, and they did these double-blind, placebo-controlled, the really good studies that they all like to see, that at the end of the studies, people that were taking the gasseri had lower abdominal girth, so they lost weight around the waist, and their whole BMI reduced. So, good for all that. Some of those little bugs that probably are inhibited by gasseri actually will make calories that the person absorbs.
Explain that a little more.
Okay. So you might have some bugs living in, not you, but some people that eat maybe a high carbohydrate diet, feeds these little guys in their digestive tract, and then these little bacteria that are growing and growing out of control actually make calories that the person absorbs without having to eat any extra food.
So you could just sit here and gain calories.
And you've heard people say that.
Yeah.
You've heard people say that I hardly eat anything, and the doctor says that my thyroid, my metabolism is fine, but here I am drinking virtually water and gaining weight.
Wow.
This could be a key. So eating or taking in the probiotic gasseri may keep that bacteria in check. That could be why the people are losing weight and having a better BMI just by taking a probiotic.
Wow.
I know.
That's pretty neat.
I know. And how can the healthy bacteria also affect your mood? Healthy gut, happy brain.
Yeah, well, kind of talking about the gasseri, it induces the IgA production, and that secretory IgA is in your intestinal lining, and it acts like a defense barrier. And when you get under a lot of stress, that IgA goes away. So if you get really low on that IgA, you have a lower immune system, you have difficulty with so it would
allergies, diarrhea, and something else about that gasseri. I'm going to have to stock up on this because when we start telling people around it.
Okay, I forgot how good
cholesterol. It also reduces cholesterol. The Journal of Dairy Science 2010 showed that the Lactobacillus gasseri helps keep the cholesterol in check.
Wow. Huh. That's amazing.
I know.
So somebody who has regular cholesterol wouldn't necessarily lower it and make it bad, but it's going to keep it more in balance properly.
More in balance.
Allows the body to do its job to balance.
Women, this seems totally unrelated, but women with menstrual pain. There was a study in Cytotechnology 2011, 66 patients with endometriosis showed significant greater relief of the menstrual pain. So why, we have no idea. I have no idea, but I'm sure they're researching it, trying to figure it out.
Yeah.
And respiratory health, it's that those little probiotics. So we're going to be taking in all these. You want them to stay there. You want them to grow. They need then what's called a prebiotic.
Okay, so that prebiotic is something that is necessary to help the...
Yes, so first of all, you need to take the lactobacillus so that it gets that foundation.
Starting point,
But then there are fibers that almost provide a soil in the gut so that it will grow. So some of those are just naturally occurring in your food.
Okay.
So olives.
Okay.
Psyllium, which is, you can get that in Metamucil, but all the barley fiber, the oat fiber, asparagus, a lot of vegetable fibers will help that grow as well. So, and then healthy fats. A lot of the probiotics need to have good, healthy fats to grow. So if people are on a real low-fat diet, that also isn't good. So, yeah.
Oh, interesting. Well, it's really important, like you were talking about those different fibers, to keep the bowel regular, to keep the bowel moving. And a lot of people think that they don't need to go to the bathroom more than once a week. That's a big problem. You need to go you need to go several times a day.
Yes.
Yeah,
that's
keep everything moving.
Some of the what we would consider primitive cultures, which I kind of question that statement. But in Australia, the Aborigines, when they analyze their digestive function, they have an abundance of fiber and probiotics, some of them that we're not even familiar with, do not exist in our environment. Wow. So, so it's I remember when I was the lactation consultant for WIC, and I had to, teach people all about why it's good to breastfeed and nurse babies. One of the things was that if a child is breastfed, there is actually a probiotic in the gut of that person when they are elderly that only breastfed children have. Yeah, so 90 years old, you can analyze them and just kind of see how their childhood went. So,
So what do you look for if you come to the Good Earth Health Food Shop, for example, and you're looking for some of the products you're talking about here? Do you have to know all those names that no one can remember except you two?
Well, we have it all written down there, but some of them are going to be in the refrigerator because some of them are not shelf stable. Yeah. And what I always recommend is let's start out with Acidophilus first and foremost. Then when you go through that bottle, then we want to start spreading out the foundation. So then we go to Acidophilus Bifidus. Now brand has a wonderful one. You do have to be very careful about the quality because they have analyzed 14 big brands and only one of them contained the amount that it said it had on the label.
So you can get all the information just by stopping in and saying, "Hey, tell me about probiotics and what do you think? What do you think would be good for me?" And that'll tip them off. Then, right?
And then what we ultimately want to get to is one that has a wide spectrum: probiotic 11, probiotic 12, probiotic 10, which has all of the probiotics that will always be like putting a little bit of them in there all the time. So, just going to prevent an imbalance, prevent deficiency.
Yeah, excellent.
Well, let's tell the folks about the websites, debford.com, that's DEBFORD.com, or drrainey.com, DOCTORRAINEY.com in this case. Thank you both for being here. I'm Chris Roberts, and that's today's Chiropractic and Nutrition. Catch you next week.